Hello, my name is John Ferris. I'm an ophthalmologist with a special interest in treating patients with squints, and I would like to introduce you to the squintclinic.com website. There are a multitude of medical websites, and quite a number of these provide information about squints, or strabismus, which is the medical name for squint. So what makes squintclinic.com different from all these other websites? Although the site has been created by eye care professionals, we have tried to put ourselves in the position of a patient with strabismus, be they young or old, and have designed the website from a patient's or parent's perspective. Having talked to and listened to our patients, what they want to know can be distilled into three broad categories. Firstly, they want to understand more about their condition. What is the nature of the condition? How can it be treated? And how successful is treatment likely to be? Secondly, what will happen when they go to a squint clinic? Who will they see in the clinic? And what tests are likely to be done? And finally, if an operation is needed, what is likely to happen when they come to hospital for their surgery? If I start off by looking at the first of these questions, how can we ensure that our patients understand more about their condition and its treatment? And what are the barriers to achieving this? Traditionally, medical information has been given verbally to the patients and parents during a consultation, but there's very good evidence that less than 10% of this information is actually retained following the clinic visit. Frequently, only one parent may be able to attend the clinic with their child, as it is asking a lot of this person to accurately pass on information to their partner. Written information in the form of patient information leaflets can be given to patients and parents to reinforce what has been said in the clinic, but by their very nature they are one-dimensional and do not take into account the fact that some people just want to know the bare minimum about their condition, whilst others want to know every last detail about the condition and its treatment. Finally, doctors are often guilty of using overly technical language, and ophthalmologists are often the worst culprits. So how have we got round these problems? To try and explain the often tricky concept of squints and other related conditions such as amblyopia or lazy eyes and refractive errors, we felt it was important, first of all, to explain how normal vision develops and how the eyes work together to create a three-dimensional image. But rather than providing this information in a long-winded written format, we have devised a series of video podcasts with animations to illustrate normal visual development. We have then gone on to develop a series of audio and video podcasts to explain the basic types of squint in simple lay terms, before moving on to talk about specific types of squint and their treatment in more technical language. This layered approach means that it is possible for patients and parents to delve as deeply as they wish into the condition and its treatment. The beauty of these video podcasts and animations is that the information is presented in an easily digestible format that can be readily accessed on computers, mobile phones, tablets, and can be easily shared with others. Secondly, the clinic experience. It is very easy as healthcare professionals to forget how intimidating a visit to even the most patient-focused hospital or clinic can be. And a lot of patients' anxiety is related to this fear of the unknown. This is especially true for children, and is why we wanted to create a series of videos to illustrate who you are likely to meet in the clinic and what tests may be carried out. We appreciate that every eye clinic will be different, and that the professionals carrying out the tests may differ from clinic to clinic and from country to country. However, the nature of the tests themselves will be very similar in all squint clinics. Finally, every surgical unit will be different, and the exact details of the patient's experience will also vary from unit to unit. However, wherever you or your child are treated, it is likely that you will meet nurses, surgeons, anaesthetists or anesthesiologists, as they are known in the United States, all of whom will have broadly similar roles to their colleagues in other hospitals. By creating a series of videos of these staff talking about what happens on the day of surgery, and perhaps more importantly, videos of children and adults talking about their experiences of squint surgery. We hope to demystify these visits to surgical units, abolishing the fear of the unknown and making the whole experience less stressful for all concerned.